Hey there, Dr. Alan Christensen here with you, and wishing you to have great, abundant, endless energy. You know, nothing worse than wanting to do things and live your life and just not feeling up for it, and just needing more rest than you want, not really having the motivation to pursue your wild and crazy dreams. So let's look at the 14 hidden causes of fatigue, what they are, and call them out and get to their solutions, so you can have just more abundant, free energy and do the things you want to do. So for starters, this is something to where it's important to identify what are the specific culprits. It's often a thought that you can just do things to boost energy non-specifically. Caffeine, stimulants, they work in the short term, but they're counterproductive in a matter of even just days. You're more tired than you were going into it. There was actually a friend of mine who asked me about a mutual patient and said, hey, she was wondering about Adrenal, which is an ADD medicine. Her husband had some, she took it. She's had some ongoing fatigue and she felt better short term, and should she take this? And I said, well, she has some problems we've identified in terms of carrying gadolinium, this toxin in her body, and her thyroid function is improving, but it's not quite on track yet. It should be just a few more weeks. And yes, the Adderall would give her a burst in the short term, but these ways in which her body isn't working right, it would only make the underlying problems worse. So I really want to see her do better in the long haul. I'd recommend against it. And the same thing for other stimulants when you're tired. They won't help you in the long term. So what are the big causes? Well, one of the first ones I would talk about would be your adrenal function and your adrenal cycles. Now, think about this especially if your fatigue is worse at certain times of day and if your blood pressure is unstable. How do you know if you've got this? Easy thing. Check out adrenalquiz.com. You can also do a salivary cortisol panel if you need be. And from adrenalquiz.com, you will get detailed directions on how to help that out. If they're not working great, what you can do about it based upon which level they're in. So next up, let's think about apnea, about poor quality sleep and inadequate breathing throughout the night. So what might make you think if this is your fatigue pattern? Well, if you really wake up tired, you do a lot of sighing or yawning throughout the day, and your sleep is just not well refreshed, this could be the culprit. This could also be relevant if your bed partner says that you snore hard or, catch or hold your breath at some points throughout the night. How do you know if you have it? You'd really want to do a sleep test. And there's different versions of those. Some of the newer ones are pretty easy. I did one. Dr. Michael Bruce helped conduct one on me a few years back. The old versions was you had to go in a laboratory and get a lot of stuff on. The newer versions, you wear a simple strap around your chest, also a little tube going to your nostrils, and you sleep at home in your own bed. Crazy easy. So the better ones are not that difficult. What do you do about apnea? One of the biggest things is just losing some weight. Even about 5 or 10 pounds can make a big difference for it, because that little extra weight makes your diaphragm less able to move throughout the night. And that's the biggest problem when you're in that most critical deep stage of sleep. Some people can also do really well with dental appliances. Some need a CPAP machine. Some do well with deep breathing exercises. But the first thing is identifying to see if that's a culprit or not. Okay, so next cause we think about would be anemias. This is especially relevant if you notice that you've got the fatigue, but you'll get dizziness when standing. Or if we see that these symptoms get a lot worse right before, right during, or right after your period. And that's relevant because if you're somewhat anemic, the blood loss associated with your cycle can make that worse. If you're a woman who's menstruating, if you're vegetarian or vegan, these things could put you at risk. Also, if there's more chronic malabsorption. How do you know if you're anemic? Well, think about some blood tests. That's the best way to go for that. There's actually a lot of ways to quantify anemia that include red blood cells, percent iron capacity, transferritin. Ferritin itself is one of the easiest markers. And probably 70 to 120 is a sweet spot for women. If you're way below that, this could be the source of some symptoms. And what do you do if you're low? Well, you'd want to get some more iron in your system. And plant-based iron, I hate to say it, doesn't always do the job. And even animal-based iron, oral, is not effective. So if someone's low, I will often start with iron supplements. There's a version called iron bisglycinate. That's probably the best overall absorbed iron without being constipating or irritating for the intestinal tract. Some do well with intravenous forms of iron, at least initially, to get them built back up again. Another one is B12 deficiency is a big cause of fatigue. So how would you think if this was your culprit? Well, the fatigue would be there, but along with that, we think about numbness, nerve tingling, memory loss. This can be pretty rampant in vegans, vegetarians, also those with poor nutrient absorption. How do you know if you've got it? Well, there's serum B12 tests, which are good for the latter stages of B12 deficiency. There's also methylmalonic acid tests via blood and probably better yet through urine. They can show slightly earlier stages. There's also transcobalamin tests, which are available outside the US, that may be the best at some of the earliest stages. And then a simple part of your blood count, your mean cell volume, that can also show earlier intermediate stages of B12 deficiency. You know, one quick note, the serum B12, that can be very high in those who take supplements, but it's not saying they're toxic. So not always a bad thing to see it elevated if someone's recently taken a supplement. What to do if you're low in B12? In the diet, we get this exclusively from animal foods. There has been talk about some versions of B12 in miso or natto or spirulina, but that's really not panned out, unfortunately. But it can absorb from supplements. The methyl versions are preferred. One can do sublingual, and there are also B12 shots available, which can do a great job making up for the deficiency. You know, odd thing, but they used to call B12 deficiency a pernicious anemia. And pernicious meant deadly, like really bad, because before we had simple B12 shots, it was fatal. It was that severe. Next up, hidden cause of fatigue, caffeine toxicity. When would you suspect this one? Well, we've got the fatigue, but it's worse before you have some caffeine. And along with that, we could see poor sleep quality, anxiety, tremors, memory disturbances. How would you know if you have that? Well, if you're tired and run down and you've got some of those associated symptoms and you use caffeine regularly, even a serving a day, I would encourage you to do a 3-week test and just do 0 milligrams of caffeine. You know, tea, coffee, chocolate, skip them for 3 weeks and watch all your symptoms. If your symptoms don't change, it probably wasn't the caffeine, and don't worry about it, go back to it. But please try it first, because you'd be amazed. I've had so many people to where that was the smoking gun behind fatigue, insomnia, blood pressure issues, lots of things. So just in general, if you need it every day and you never miss a day, that should raise a red flag. If the idea of taking a few weeks off freaks you out, that should raise the red flag. You're the person who needs to take a few weeks off. I remember conversations with people thinking about their anxiety, their insomnia, and I'll ask about the caffeine. And some people just don't want to talk about it. I'm like, wow, as much as I hate to do it, that's where I've got to go, because that's going to change that person's life. Other people are completely indifferent. Like, I have a cup of coffee most days. I skip it now and then, no big deal. You know, that's a dead-end discussion. That's not a factor for that person. But whenever someone, yeah, just don't miss my coffee, that's the addiction talking. No kidding. This is a stimulant. This is an addictive compound. No debate. Give it a try. If you've got a good relationship with it, you can take some time off. It may even have health benefits for you. But if you're in that addictive cycle, it's probably not serving you, and it's probably even raising some risks. So the other big one we think about is hydration, believe it or not. So simple thing, but this is the routine fatigue, but also you may see dizziness or muscle pain. And how would you know if this is you? Well, your urine is dark. Now mind you, thiamine can skew it, can make it look kind of yellow, but it's just darker than it should be. And if you're not sure about that, shoot for 3 to 4 quarts of purified water daily for at least 3 weeks. And funny thing, but when you're underhydrated, you may be under thirsty, believe it or not. So when you get rehydrated, you may have a stronger, healthier thirst response again. Another big cause of fatigue could be depression. So what's distinct about this fatigue? Well, you may also feel body pain with it. Irritability, withdrawal from social activities, digestive symptoms, numbness or tingling in the extremities. How would you know about that? There's some great quizzes I'll give links to. Also speaking with a good health professional or mental health professional. And if you think that's the case, screen thyroid function. There's so much overlap between poor thyroid function and depression. Consider cognitive behavioral therapy, look at journaling, get your blood sugar dialed in. Caffeine, alcohol also been shown to worsen depression. The more exercise you get outdoors, probably the better you'll do. And also the more omega-3 fats in the diet, the better you can do. Another big cause of fatigue, Epstein-Barr virus. So what are some nuances with this one? Well, we've got the fatigue, but you may also have just a random sore throat, odd fevers that come and go. You may be the one that just gets sick all the time and never seems to shake it. How do you know if you've got this one? You got to test for it. There's some good tests that look at Epstein-Barr, IgM, IgG panels, PCR panels. One of my favorite treatments is intravenous vitamin C for that. It can make a really big difference. More details on Epstein-Barr, please Google my name and Epstein-Barr. You'll find a detailed article all about just it. Next big hidden cause of fatigue would be food intolerances, food allergies. The nuance here is that we'll see fatigue, but then also gas and bloating, rashes, joint pain. And you know if you've got it if you can see these symptoms come and go when you're fasting, or if you've done food elimination for about 3 weeks. So to find out about it, do a good screen. Testing can help a lot. And please Google my name and Ultimate Guide to Food Intolerance, and you can learn a whole lot more. A few more causes of fatigue. Well, there's heart disease. And with this one, you'll often notice that it's worse when you're physically active. Like you go up a flight of stairs and you're just exhausted or winded from that. Please stay on top of your blood pressure. Watch your resting heart rate in the morning. It should be less than 70. Keep tabs on your LDL levels, but also be aware of advanced markers like LDLP, C-reactive protein, fibrinogen. And I'm a big fan of just detailed testing too. Get a coronary artery CT, get a stress test done, and know if there is any dysfunction. It is treatable even if it's there, but if it's not identified, not always treatable. So learn and find out, especially if you get winded when you're physically active. Another big cause can be hypoglycemia, just random low blood sugar. So along with the routine fatigue, you can suspect this if you get irritable, you get brain fog or shaky, and food makes it all better. So any symptoms that are better with food may be hypoglycemic symptoms. And you can do things like glucose tolerance tests to be sure, but honestly, if there's symptoms that are better with food, that's probably confirmation of it. Something I love to do is encourage people to use, for testing purposes, simple glucose tabs. So all the pharmacies have these, they're non-prescription, and in about 5 minutes, they can reverse low blood glucose and help symptoms. So again, this is not a long-term treatment for you, this is just to identify if hypoglycemia is one of the causes of your symptoms. When you're feeling off, pop a few glucose tabs, melt them under your tongue, and if you've gotten better in a few minutes, it was because of your blood sugar. And to preempt that moving forward, always shoot for 20 grams of protein with your breakfast, at least 5 grams of fiber, lots of resistant starch. Stay low on sugar, get good carbs, stay low on saturated fat, get enough protein. Good ways to manage the blood sugar. Now another big cause of fatigue can be hypothyroidism. So we've got the fatigue, but this is more steady throughout the day for most people. We could also see muscle pain and other symptoms like hair loss, weight gain, or drier skin. You can find out about this with a simple thyroid quiz. That'll give you some guidance on future action steps as well. Another big cause of fatigue that's often missed is magnesium deficiency. We think about this one especially if there's sugar cravings, muscle cramps, and leg tremors at night. If your diet is low in legumes, or low in nuts, or low in seeds or greens, you're especially at risk for this. You can find out about this for sure by RBC magnesium test. They're probably the best way to go for it. Some of the best food sources would be adzuki beans, pumpkin seeds, spinach, and my favorite supplemental version is one called dimagnesium malate. It's really well absorbed and it's less apt to cause the diarrhea or the loose stools that many types of magnesium can. So last up, big hidden cause of fatigue, urinary tract infection. Now, here's what we always think. Wouldn't it hurt when I pee? Wouldn't I have burning pain on urination? For men, usually. For women, not always. So the urethra in a woman, the opening between the bladder and outside of her body, is not large, and there's not a lot of nerves on that. So you definitely can have pain with a bladder infection, but you can have a bladder infection and not have pain. There could be back pain with it, or fever, or headaches, or honestly, no obvious symptoms. So if you are run down, that's one more thing to think about. Have your doctor do a simple urine test, but also do a urine culture, because sometimes The in-office test alone won't be adequate. And do know that many bladder infections, they are recurrent for women. And what can happen is that they take an antibiotic, it goes down, but it comes right back again. And in those cases, mannose can be a really good way to help reverse that. And another one here still is vitamin D deficiency. So along with the fatigue, we could see poor immune function, chronic pain patterns, and just low rates of healing. And this we know about through testing. Ideally, we would see between about 40 and 55 nanograms per mil. But the more you are below that, the more it could be a culprit. And most I see do really well on about 5,000 units of vitamin D. The sun can be hit or miss for reversing it. So check your vitamin D, build it back up again. And think about those 14 steps and get your energy back up again. I would love to have that happen for you. Take great care of yourself. Dr. Christensen here. I'll see you again really soon. Bye-bye.